We're going to talk now about the Nerflex Restorative Safe Serv Headpiece. This, you attach that to the Vertebrese TLSO, and these are pockets in the back. You already have your vertebrae put on the patient. You have it setting up, and then in the sitting position or standing, you're going to put this on. This is for patients, this one is a left, that have left or right leaning head, neck. All these torticollis issues are very, very prominent in patients of all ages, from your newborns all the way up. Kids with cerebral palsy, any type of brain spinal cord issue can result in this torticollis dystonia, and it could be just left or right leaning, it could be hyperextension, it could be forward, it can have that wry neck twisting. So right now we're going to talk about the Safe Serv for left or right leaning or with the wry neck. It has a support for the side to which you're leaning to help give you a little bit of a tug. If you'll notice, there are arced holes in the vertical slat. This simply slides in the back of the device. If your patient can comfortably be ranged to almost neutral, then you're going to just leave it straight up and down. If they're really severe leaning, then you're going to put it in one of the arced holes, but it's very, very flexible. So, this vertical slat is very easily heat moldable. It's very simple to do. We have therapists and orthotists and fitters that do this all the time. Fitters are very good at this. Orthotic fitters that have been trained by us to do it. It requires a heat gun that you can get at Lowe's, Home Depot, any store, hardware store that sells paint. And please refer to our website, restorativemedical.com, or to MMAR Medical's website for those videos that show you how to heat mold. But again, you have that fishing pole type of flex technology that allows the patient to comfortably pull into their tone and go back. This allows them to lean into their tone. Now I've set this straight up. So the patient is still going to the left, but we can range them almost to normal. Never, ever, ever torque a neck. Never. You want to massage their shoulders, make them comfortable, and just have their therapist or their caregiver to bring their neck up very gradually. We want to make sure that we're just looking at reducing the tone, relaxing the tone to reach muscle inhibition, that relaxation. Then we want the prolonged low-load passive stretch that over a period of time, it's this process, this restorative process that will re-lengthen shortened tissue. We know literature says it takes 6 weeks of prolonged low-load passive stretch to realign the actin and myosin in the sarcomere units in the belly of the muscle to prepare it to be re-lengthened. So if we're overstretching and too aggressive, we run the risk of hurting our patient needlessly, of ripping muscle, of tearing muscle away from tendon or tendon away from bone. It's very easy to push too far too fast or just too far and kick in the stretch reflex of our patients, and they rebound back in a much worse condition. So go very, very slow. These patients didn't get there overnight, and we don't want to try to correct them overnight. It is a process. Now, all we have to do with this then is slide it in the back of the device. And these are sized according to the height of the back that you order for your patient. And again, it has that fishing pole technology. Now, one of the things you want to remember with this, because you are we're doing active therapy with this is if you're leaning to the left, you have overstretched muscles here and contracted muscles here. So we're going to have to let these go back and these re-lengthen. When you get to midline, and many of these people get to midline, it's just a matter of going through the process of every 2 months, you're going to look at them again and see if you can correct them a little further. But once you get to midline, unless it is contraindicated, you want to pop this out, and it's snug because we don't want it roaming around. There. And you're going to stretch them to the opposite side. So these shortened muscles have a chance to overstretch, so you rebound back to neutral. Then you can go back here for a maintenance. If you think of this like the dentist or orthodontist putting your braces on your teeth, he or she is going to move your teeth and overstretch them to where they rebound back to where he wants them. Then, just like wearing a retainer to keep it in alignment, even if you get the patient totally corrected, you overstretch them and they rebound back here. And see, if you don't overstretch, they may tend to always want to go back toward the shortened side, especially if they get sick, they have the flu, they go to the hospital, they're upset about something. Even, excuse me, once you get them here, you want to, you can discontinue this, but don't throw it away, don't discard it. Hang on to it, because like your retainer for your teeth, you may need to get it back out and do maintenance from time to time just to make sure you have good stretching. So it's so exciting when you can correct a patient and discontinue a part of it. But just remember, our neurological patients, if you have any type of issue with your brain or spinal cord, and it could be MS, it could be dementia, Parkinson's. It doesn't have to be just a stroke or a spinal cord injury. Any of those conditions can result in neurological tone, and those patients may need us for the rest of their lives. So if we stay ahead of that tone and spasticity and don't let it catch up with us and create a problem before we catch it, then we will continue to prevent these deformities, and we're going to work to correct what is there. Again, this is the Safe Serv left that's worn with the Vertebrese TLSO.